Hi, welcome to the NCRAN webinar. My name is Sarah Ritchie. I am the Lifespan Program Manager in Human Development and Relationships Institute at UW-Madison's Division of Extension. And I am going to present to you on our efforts to increase social connection in Wisconsin through programming and partnership. So first, I'll go over a little bit of some background around social isolation and loneliness, and then I'll dig into our response and where it started with COVID-19, some direct education that we've been doing, and then our efforts with the Wisconsin Coalition to End Social Isolation and Loneliness. All right, so some of you already may be familiar, but social isolation is the lack of social contact. So someone that is socially, here, I'm going to try to move my stuff here so I can see my notes. Sorry about that. Social isolation is a lack of social contact. Someone that is socially isolated and isn't seeing a lot of other people, someone that lives alone, have mobility issues, and maybe cannot leave their house. Loneliness is a feeling of being alone, so that like social hunger, it's a cue that tells us that we need social connection. It's an issue when we cannot go out and fill that need by interacting with others or connecting to others. 1 in 3 adults reported feeling lonely pre-pandemic. There is a difference between social isolation and loneliness. You can be socially isolated and not feel lonely, and you can also be surrounded by people and feel very lonely. Even though we think of them hand in hand, they are two different things. Older adults are at a greater risk for social isolation and loneliness because they're more likely to live alone and experience more loss of family and friends. They're more likely to have a chronic illness that may prevent them from gathering with others or even leaving home. They are also more likely to have functional limitations that prevent them from interacting with others when in public, such as a hearing loss, which may make it more difficult to interact with others. And in some cases, they may avoid interacting with other people altogether. Research shows that chronic social isolation and/or loneliness adversely impacts both mental and physical health. When someone is experiencing chronic social isolation and loneliness, their body is flooded with stress chemicals, resulting in lower immunity and higher inflammation, which can create a downstream effect causing chronic health conditions. Social isolation and loneliness are associated with an increased risk of depression and anxiety, and it's also associated with dementia, heart disease, and stroke. Social isolation and loneliness can even be associated with premature mortality at the same level as risk factors like smoking and obesity. So in 2018, there was a study that made headlines showing the connection between social isolation and loneliness and premature mortality at the same level as those risk factors. This is a huge concern, and it's something that we can work to fix with different strategies that work to improve social connection. And we know that the research does show us that high quality social relationships lead to longer, healthier lives. So this is something that we want to do to help people if we can. In direct response to mitigate the negative impacts of social isolation and loneliness during the pandemic, Extension created and disseminated easy to access resources involving a resource guide, a decision-making tool, and best practices or lessons learned in program response to communities, organizations, and individuals. These efforts were designed to build capacity in local communities and provide them with the tools they need to respond and reduce the negative impacts of social isolation and loneliness on older adults and other high-risk individuals. Our survey data and continued discussion with our community partners and educators has informed programming responses beyond the pandemic and informed our communities on how to respond in the future if we experienced another event such as the COVID-19 pandemic. And this is one of Extension's first responses to social isolation and loneliness. So our first tool that we created was the resource guide, and we created that with the intention of building capacity in extension educators and their community partners to respond to the needs of residents in their local communities. This guide is currently being used as a resource provided to agencies screening for social isolation and loneliness, which I'll talk about a little bit more later. The decision guide was developed to help people make difficult and personal decisions about how and when to move out of quarantine and start interacting with others. Bringing in respite care, going to doctor's appointments, and sending children back to school or daycare. This tool served its purpose during COVID for participants and will help inform future responses around other emerging issues. The next prong of our three-pronged approach was the partner program survey, which was an effort to collect and compile information from adult serving agencies or groups on programming that addressed social isolation and loneliness, and the results were shared out with our partners on social media and posted on our external website. And the intention of this survey was to help inform communities across our state of what programming was happening, best practices and lessons learned, and to connect people with each other if they wanted to try to replicate programming in their community. Our next effort is a direct education effort that we call the Wise Wisconsin Virtual Learning Series, which we launched early in 2021. We launched this effort to connect individuals in meaningful ways to provide opportunities to learn, share, and grow together. The goal of the program is to provide knowledge and resources on topics to help participants enrich their lives while building in opportunities for learning from others and sharing their own experiences to build a sense of connection to others virtually. Topics such as finding joy, compassion, resilience, retirement transitions, and gardening were selected, among others, to meet both of our program outcomes of increasing knowledge and skills around self-care techniques and increasing social connection. So our Lifespan team had been very intentional and continues to be very intentional about building in opportunities for participants to engage using chat, annotate, and polls. This effort is offered statewide, and we even have participants from out of state that connect and join us on a yearly basis. And this was the first and only program that we developed with the outcome of increasing social connection. We know based on observation and participant testimonials that our other programs have an unintended outcome of social connection, but we've never actually developed a program with that intention. In our first year, we offered one 6-week session and one 4-week session because we had such a strong interest from participants, and that was really in the beginning of COVID, or that really difficult time during winter when people are feeling especially socially isolated in our rural parts of the state. So we did offer two sessions or 2 series that winter, but we've continued to facilitate just one 6-week session each of the last 2 years, and that's how we'll continue moving forward. So we asked participants 2 questions on our follow-up survey about social connection using a Likert scale from strongly agree to strongly disagree. The first statement was, attending the session made me feel more connected to others. And the other was, attending the session provided me with more skills and knowledge to be connected to others. Our survey results from 2021 and 2022 showed that 88% of survey respondents indicated as a result of the program, they felt more socially connected to others. And 88% felt that they received the skills and knowledge to connect more with others. One participant of the program said, "This helps me so much to have these virtual classes. They are social as well as informative, and I need that at this challenging time." Another participant said, I'm happy that the series continued. There are so many topics worth discussing, and connecting outside of our bubble is beneficial. So WISE Wisconsin had, it was like I said before, mostly older adults joined from within Wisconsin and beyond. We had around 709 participants register with 2021 and 2022. We haven't added the 2023 data. Our series just wrapped up in March. But we record and archive or record and post on YouTube all of our videos so people can watch them as they have time. So even though 709 participants registered, some of them registered with the intention of watching the video later. So we had a combined total views of 1,227 for our YouTube series just between 2021 and 2022. This effort has also helped us build a listserv of around 320 people from across Wisconsin and beyond that we can promote our extension programs to. Based on our observations and findings from the WISE Wisconsin series, we were interested in evaluating the impact of other extension programs that we offer. So we added the evaluation statements or questions or some adaptation of those to our Aging Mastery program and the Strong Bodies program. Extension held 42 Aging Mastery program workshops with almost 500 participants since 2021. We did not implement these questions right away, but we were able to survey 168 of those participants, and 88% of them felt that it improved their social connection by attending that program. We also added it to our Strong Bodies program. In 2022, there were 142 sessions of Strong Bodies that were evaluated with 1,326 participants surveyed, and 67% of those felt more connected to others, and 63% of those felt like they received the knowledge and the skills to be more connected to others. Gathering evidence like this for our programming helps us share these impacts with providers, our coalitions and local partners that serve older people, marginalized populations, and others that are at high risk for social isolation and loneliness, so that they'll be able to refer them to our programming in the future, knowing that these programs do help people feel more socially connected to others, even on a virtual platform, because many of these programs were evaluated during COVID, where we saw most of our people not wanting to leave their house or do in-person programming. So over the course of the last 3 years, with all of these efforts, we've been able to connect with several state partners to share our programming evaluation tools and our responses to the COVID-19 pandemic, and what the impact on social connection has been through our program efforts. And through these touch points, we've built relationships with other service agencies that are working towards the same goal of increasing social connection among older people. And it's because of these connections that we were invited to be a core member of the leadership team for the Wisconsin Coalition to End Social Isolation and Loneliness. So these are just a few of the partners that we've connected with to, I guess, be a part of this coalition. So there are agencies on aging. We have the Wisconsin Board for People with Developmental Disabilities, UW-La Crosse, the Greater Wisconsin Agency on Aging Resources, which actually serves and supports all of our aging and disability resource centers across the state. The Wisconsin Coalition to End Social Isolation and Loneliness has several work groups: Access and Detection, which I am a co-chair of, Public Policy, Public Awareness, Measurement and Equity. The leadership team created the coalition marketing materials for awareness and recruitment. So we've been able to host monthly coalition meetings after we've got people across the state interested and involved. We offer opportunities for professional development for coalition membership. And our leadership team continues to meet monthly as well. And our leadership team right now is comprised of those agencies you saw on the last slide, as well as the co-chairs of each one of these work groups. Some of the things that I'm going to highlight are, I guess, successes of our coalition this far. So in 2021, and I should say this coalition started around the end of 2020, beginning of 2021. And I was invited to leadership team, I think, right around the beginning of the coalition's inception. So in 2021, our Public Awareness Committee worked with our governor on a proclamation to declare December 15th Loneliness and Social Isolation Awareness Day. Governor Evers, our governor, has also declared a week in November as Social Isolation and Loneliness Week, in which our coalition has offered webinars and a toolkit for agencies to use during that week to spread awareness of social isolation and loneliness and its impact. One of the other projects our coalition has been working on is an effort to screen, identify, and refer folks that are socially isolated and lonely in local communities across the state. So our access and detection work group, which I co-chair with a colleague from the Greater Wisconsin Agency on Aging Resources, has been piloting the 3-item UCLA screening tool into existing intake processes in 6 local ADRCs and aging units and 1 agency serving adults with disabilities. Our team spent time reviewing several different screening tools and landed on the 3-item UCLA tool. It's also been used in our the meal site program, so we know that some people in our state were already familiar with the tool, and it's been well vetted. So the purpose of this pilot was not to evaluate the tool itself, but the actual process of utilizing the tool in an intake system. So we selected the 3-item UCLA tool, and then we worked to recruit pilot sites based on priorities that were outlined in their 3-year aging plan. So if an agency on aging or ADRC identified that social isolation and loneliness was a top priority for them to be working on, they were invited to join an informational session that our group put on about the pilot. And that is where we did most of our recruitment for the pilot. For folks that were interested in participating in the pilot, our team offered a longer training on how to use the screening tool and other tools that we put together to support the process, an overview of motivational interviewing techniques, and then the resources available to follow up with folks when they were identified as socially isolated or lonely, and then how to use our debriefing form that we created so that we were able to collect information and feedback on each of the interviews. We also asked pilot sites to do at least 10 screens between September and December of last year. Each of the pilot sites that participated received a gift card to provide lunch or some sort of, I guess, food reward to their screeners or the individuals that participated in the screening with us or the pilot project with us. So once we completed the pilot in December, we wanted to allow enough time for people to get the 10 screens in. So September to December, that kind of gave them an opportunity to decide when during that 3-month time frame would be good to start implementing the tool. Also, some of our agencies that participated were pretty far north and in very rural communities, and they may not see that many clients. So it also allowed them more time to get those 10 screens in. Once the pilot was completed, we invited the screeners to attend a 1-hour focus group just to dig in a little bit more around the successes of the pilot, barriers they were seeing, the ease of the tools and resources that we provided for them, in addition to like the training. Was it enough? Was it not enough? as well as gaps that they were seeing. So our team right now is currently compiling that data from our focus group. And we are also now piloting the tool in a healthcare system, which I think is very exciting to get our healthcare systems involved in this. They are in Southwest Wisconsin using community health workers and a provider referral system to identify or to refer patients to community health workers to do this screen, and then the community health worker will identify resources to connect those individuals that screen as socially isolated or lonely too. So the resource tool that our extension team created early on in the pandemic is a tool that we use in our pilot, and I guess in this process moving forward, to help agencies identify some of those emergent needs, like maybe suicide hotline or other numbers that people might need, not necessarily to programs, but some of the emergency needs that people might need if they are socially isolated or lonely. So the evaluation of this is sort of twofold. So the purpose of the pilot was to find out if the tool was easily integrated into our existing workflow, and we found that it was easy to integrate in person. And it also opened doors for deeper conversation with folks that didn't even realize that they were socially isolated or lonely. A number of the pilot agencies are actually interested in integrating the tool permanently into their workflow, which is also exciting because that was sort of the goal of our pilot, was to figure out, how does this work? Is it easily implemented? And is it something that we can push out on a statewide level to support for our agencies in every county to be doing the screening for? So pretty excited to see that some of the counties are on board. And one of our larger counties, Brown County, which is the Green Bay area, is permanently implementing that into their workflow now. So that's pretty exciting. During the pilot, we also found that the screening was effective in identifying 40 of the 96 participants that were scored as socially isolated and lonely. And in 46% of those cases, of the 40 people that were isolated or lonely, the interviewer provided resources or next steps to those individuals that were screened. And one of the stories that a screener shared with us, she was actually a community health worker working with a local ADRC. She shared with us that she was doing home visits. And so she was using the tool during her home visit time. So it really allowed her to dig a little deeper with these folks that she was screening. And she met with one woman who did not think that she was isolated or lonely at all. And then after she did the screening, she screened a little high. And so the screener was able to talk to her about, what are some of the things you like to do? What are some things that you haven't been doing that you'd like to start doing again? And she found out that this woman really enjoyed walking and exercising. So she connected her to the Walk with Ease program, which allowed her to meet other women that she now has a walking group with. So that's pretty exciting. So now this woman is doing something to feel more connected to others and to be more connected. And she didn't even realize that she was socially isolated and lonely. So the findings of this pilot process have been pretty exciting. And we're really hoping to see that it gets pushed out more broadly across the state. So some of our next steps is to continue to evaluate the impact of our extension programming on social isolation and loneliness, so that we can just continue to beef up that evidence to show our partners that our programs are good for referral, especially if we start doing more screenings of people. So our local ADRCs and aging units implementing the screening to detect and refer people is something we're working towards. Our coalition efforts would to show state to show more impact across the state around even bringing awareness to social isolation and loneliness and the negative health impacts, and hopefully increasing social connection opportunities as a whole. And we'll continue to share our work in state and on national stages, I guess. Our coalition work group was invited to present our project at the US Aging Conference in Salt Lake City in July, which is also pretty exciting. So I feel like I really flew through this. I will invite you to participate in the evaluation of today's session. So here is the link. I can leave that up. I will also I'll come back to that for you, or I can put it in the chat, I think. Our next webinar is on ambiguous loss on May 5th. So hopefully you'll be able to join us then as well.